Okay. Okay, I'm hoping I am on. Uh, Hello, everyone. My name is Mary Gaines, and I'm hoping that you look to join me this evening, Sunday here. I see some people are coming on. Thank you, Leslie. And I want to make sure that I bring some information to everyone. And I'm hoping to that you also invite some friends. So I'm gonna just kind of invite some more friends today. And this is, I believe, is some very important information. I'm hearing myself right now, so I'm hoping that everyone that comes on, as you come on, you will give me at least 15 minutes so that you can hear what is going on right here in your country regarding your health, regarding prevention, on diabetes, and also on what we can do and how we can take a lead in helping ourselves uh, to get into better health. Um, I'm hoping that more people come on. I'm just kind of clicking right now and to see how many people will be able to come on today. And first of all, I just want to be able to say again, my name is Mary Gaines, and am with the Senior Health Information Network. We are actually a community-based uh, Medicare organization that is connected with Medicare and connected with the community. Our base population is basically seniors and caregivers, uh, people who are disabled, any individual that is in need of help and have to go through or navigate through the Medicare system to be able to get help. So basically, we are placed in, right now, we are out of Indiana, also Illinois. We've just registered in Minnesota, and our last spot that we will register in will be Texas. With Senior Health Information Network, we are definitely looking to do something different. The reason why I even began Senior Health Information Network was because of a personal situation regarding my own parent. Those of us who are in our 50s, we will most likely, 9 times out of 10, will probably be working or helping uh, our, our own parent, if not an aunt or a relative that's close to us, sometimes even a friend or a neighbor. You actually have to be able to advocate for them because as they get older, things happen, they get ill, they get sick, and you have to be able to know how to navigate the Medicare system. So my goal was to try to help families to be able to really advocate for their loved ones and to be able to have some options. There are options out here that a lot of times people do not know about. It is free to any person that is 65 years or older, and just as the diabetes, which I am going to talk to you about today, that also is free. It does not cost a person anything to join so that they can prevent diabetes or reverse diabetes. So what I'm going to do now is basically I'm going to just get started. I'm not sure how many people are on. I'm not, real good with this Facebook Live, but I try to do my best. So basically, what I want to really talk to everyone about is, if anyone has been following me or seeing some of my posts, I've been talking to individuals and trying to connect with individuals who I know that are either community-based, they're either a church, they're either an organization, or they might just be in some type of a social civic network. But this is for everybody. Not too long ago, our Congress which was a couple years ago. Congress had basically set with the Centers for Disease Control and Prevention, they basically set a a health model, which is called the National Diabetes Prevention Model. That model was to actually go across and be put into action with the whole United States. It was to bring this model, this health model, into communities, into churches, into faith communities, into civic organizations, into small businesses, into employers, into even just a family. Just if you have a lot of people in your family and you're being affected by diabetes, you know someone who's affected by diabetes, then you really want to look into this. This program is free. It costs nothing for a person to join. What they are trying to actually set up and begin is the people who would actually implement the program in their communities. Be it your family, it could be your own family, it can be your church, it can be your organization, it can be you as a business, it can be a network of people. We have alumni with different schools. I'm a West Side Cougar person, so of course, I know that our network of alumni, people who have graduated from West Side, we constantly try to connect and keep in touch with each other. But this is a model that anyone can be a part of. And fortunately, I am just one of those individuals who I believe in knowledge, I believe in information, and I believe in passing on information. So this information came to me because of the work I do through Senior Health Information Network. I give information, I provide information, and then I provide the services based on that information. So basically, what I did was I was able to contact Medicare because I'm already a part of what they do and what they do in the community. They requested for me to see about beginning something in a community-based or faith-based arena. There was not that many people willing to basically work on that ground level. I thought that is where people get their information. That's where people trust individuals so that you can get the right information. So basically what they did, they gave me with the Senior Health Information Network, they provided us a recognized us as an organization that would go out to do this particular work. Now, doing this particular work means creating a workforce of people. It also means creating partnerships. I'm talking about partnerships throughout the country, partnerships in any state, partnerships with any churches, partnerships with any community, partnerships with any families, partnerships with physicians, partnerships with clinics. The partnerships is limitless. We can build as many partnerships as needed to get the information out and to get the information to individuals who are what they call type 2 diabetics or pre-diabetics. If you are a person and are not aware that you are a diabetic, there is ways for you to find out if you are. First most will be, of course, your own doctor. The other thing is on the website, they allow you what they call a risk test quiz where you can basically quiz yourself. You don't have to go into your doctor and just see if you might be in that what they call that range of probably having or being at risk of being a person with type 2 diabetes or pre-diabetic. So basically, for Indiana, that is the state that I begin Senior Health Information Network with. And in Indiana right now, it is 1.7 million Hoosiers, Indiana people over the age of 20 that is living with pre-diabetics. That's pre-diabetes rather. And all of this is according to the Centers for Disease Control. That is basically where all my information comes from. They provide us with the information, and our job is to provide you all with the information. So that is one third of the population of people in Indiana. So basically, if anyone knows about what diabetes is, it is definitely something based on with your sugar levels, your glucose, and it has a lot of things that if it is not taken care of, or if a person do not know that they have it, what ends up happening, the diabetes can actually get worse over the years. Over the years, sometimes people don't even realize that they have it. For those of us, we've had people personally in my family who were and still are diabetic, and trust me, I have seen different situations where even the doctors did not know how to really treat diabetes. So, having a personal experience like that, having a loved one who actually was very affected by the diabetes, my thing was to continue to look into it, to continue to educate myself and try to inform others. So that's why I was really drawn to this diabetes project. One of the things is, as minorities, individuals who are from a minority background, we are the populations who have the highest risk of being able to actually obtain diabetes. If you have someone in your family, then most times they say that then you will probably be at risk of being a person that might have diabetes. Now, all of this is about prevention. So what the CDC and also Medicare is trying to do, CDC is Centers for Disease Control, and of course Medicare is what seniors actually have as their primary insurance. What they are trying to do is basically two things, and I'm going to be very honest about this because I've done the research. One of the things is Medicare actually found out after a research of over 3,000 people, clinical trials that was throughout the United States, and that was like 27 clinical trials. This went on probably around between 2014 all the way, up till now. And what they found out that these participants, after being able to do a specific work with them, which is called behavior change, and that's just changing your behavior about exercise and fitness, changing your behavior about how you eat, how you choose the foods that you eat, and also being educated, being able to be informed about the decisions that you're making in your life right now. So those are the things, those was 3 different techniques that they used. And in using those techniques, what happened, the individuals that were the participants, the 3,000 participants that was in these studies, what they end up finding out that the participants actually reversed their diabetes. They reversed their diabetes, being individuals that were either pre-diabetic or individuals that was very much on a borderline. I am pretty sure individuals have went to the doctor and the doctor might have said, you're borderline diabetic, which means you can go either way. That means if you don't do anything about it, you're going to move into that group or population of actually having full type 2 diabetes. If you do something about it, then you can reverse your diabetes and prevent the onset altogether. But what the doctors were not telling people, and this is where Medicare really stepped in, the Centers for Disease Control, the doctors, physicians, not really, I'm not sure if I can't really speak for them. I can only go with what I read and with what they've taught me. The doctors were only giving individuals medication. The medication we've been dealing with diabetes for the last 30, 40 years. The medication was not stopping the actual diabetes, the condition. The only thing the medication was doing was taking care of the symptoms. So the symptoms might be your sugar is high. The symptom is uh, you are you start having tingling in your feet. You start having tingling in your hand. These are the symptoms. The main symptom is the dizziness. Basically, your sugar going high, having being very thirsty, urinating a lot. These are the things that you start wondering, like, okay, what's going on? And you go to the doctor and they say, oh, well, you're pre-diabetic. Okay, at that point, they issue a person pills. What the pills were not doing, they were not basically helping the individual with the condition of diabetes. It was just taking away the symptom. So this will be, and I'm going based on what some doctors, what we've already been trained on, it will be just as if you had an infection. And if your infection, you know you got an infection because you got a high fever, you don't feel well, you're achy, those kind of things. Those are symptoms. Those symptoms are the same symptoms of a person who is a diabetic. Their sugar go high when they eat too much or they eat the wrong type of foods, whatever case may be, their sugar goes up. So these things with what I'm talking about, basically with the what the if you have an infection, if you take a Tylenol pill or an Advil or whatever, that pill is gonna make your temperature, make your the go down. It did not stop the infection. It just took away the symptom of having a high fever or feeling like you were achy. You had to actually go to the doctor to get something for the infection, which either been penicillin or some type of antibiotic. They had to give you something else to use to get rid of the infection. The aspirin or the Tylenol or Advil did not take away the infection. You had to take another step. So this, I'm saying all of this because this is a part of what has happened with diabetes. When you have diabetes, the different medications that's been put out for years with the pharmaceutical industries with diabetes, basically that was only taking care of the surface. That was it. It was not doing anything to the condition. So overall, and thank God for individuals who continue to research and do the work they needed to do and do clinical trials for diabetes. They find out 40 years later now that the way they were treating diabetes was incorrect. So your doctor has been basically treating your diabetes incorrectly. And you can ask him about it because at this point, at this time, at this day, he knows it now. He knows it. Every doctor, every physician has been given information about this. So what they have done, which is Centers for Disease Control, have said, we and the National Institute of Health have said, we're going to open this up because we need to correct it. To correct something when you have population after population, people actually being classified as diabetes or having being pre-diabetic, that means you have to do something about it. You have to correct the error. The error basically is the diabetes was not being treated correctly. So what they found out was to correct the diabetes in our systems, in our bodies, with the three things that actually work was the three things that was something that we ourselves can do on our own with the support of others and being able to accept, to change some behaviors and lifestyle changes. So those things was exercise and fitness, looking at the food that you're eating and making better choices, and also being able to have a support, a network of people that you can work with, that you can share your information with, so that you can actually make the behavior change. So these things is what basically brought together the National Diabetes Prevention Program. It was to create a new and a new type of an option for people who we're not saying don't take any of your diabetes your diabetic pills or anything medication, but talk with your doctor about this. Talk with your doctor about what is the option. Is there some options? So with those options, we as Senior Health Information Network was chosen as one of the organizations to get this information out to the masses. Basically, it's many of us that's out here, different organizations, different in every state, you in the Department of Health. But what they have not been able to do was to get this on a level of community base, of getting it with people where they can really trust one another, get with one another, and actually do these programs in their churches or in their organizations or in their block clubs or in their associations, even at your job. These are every insurance company, be it Blue Shield, Blue Cross, Mensure, whatever the insurance company is, they know about this. There's supposed to be classes that is coming that should be being implemented in your state, and if not, then you can actually do something about that. That's why I'm here today, because I love to do anything that's big. I love to do anything that deals with people and getting people information, helping people to lead something instead of being the last, but to lead it and lead it with the people that you already know. Look around the people that you already have association with. If you are one of those individuals, then you can take an initiative to partner with us as Senior Health Information Network with the National Diabetes Prevention Project. You can take a lead, a call of action, and say, hey, I know people who are diabetic, or I know people who might be even pre-diabetic. I want to I want to make a change. I want to help save some lives, because basically that's what you're doing. You're helping to save lives of individuals. Because if we don't get intervention in our communities, in our families, in our, even with the schools, in our churches, the things that end up happening, what diabetes actually end up doing, and I'm pretty sure that quite a few people might know, you probably have experienced this, you have loved ones who have experienced it, but the things that end up happening is diabetes then affect your heart. It creates heart disease, it creates blindness, it creates uh, nerve damage. It creates all these onsets of different ailments that actually hurt the patient even more. So now the diabetes, it also does amputation. That was where some things in our family was created. I mean, things had got created in basically, it was my brother-in-law, where things had got so out of hand, where that was something that ended up having to happen. And this was, a sad situation for all of us. And so I just feel like I was personally affected. My father was personally affected also with diabetes. I had a grandmother who had diabetes, but she was a very smart woman, because before this even came, she knew she could take control of her own health, and she lost weight, and she changed the way the foods that she was eating. She started to do more activities, and she basically reversed her whole diet, all of her diabetes. So this is how we know that it can happen. My grandmother did it many years ago. So shout out to Gertrude Levy, which is Gertrude Gaines. She did it before even Centers for Disease Control even talked about it. or even thought about it, or even knew about it. So this is something that we all can do, but the National Diabetes Prevention Project has pulled together a program where people can partner. So my hope, my call of action to any and everyone is to ask and request that individuals who that really believe that this is something close to your heart, you believe that this is something that's impacting your family or even with yourself, if you believe that you want to be able to be someone that can help to save lives, I believe that this is a call of action that you can take. I believe this is something that anyone who basically is willing to come in to work with us, it doesn't matter where you're at, because the way we scale the program, a lot of things are done online and some things are done person to person. It all depends on how you want your program set up. People are paid to participate in the program to get the program started. That's a key thing to this. The National Institute of Health, the Centers for Disease Control, and also Medicare, it comes a point where if a certain group if you're working with them, there's reimbursement for this. The insurance companies help to reimburse people to teach others for this. So all of these programs that they have across the country right now is open for partnerships. But what I'm hoping is that people is looking to work with me, because I want to focus on two different groups, and that's community-based. That was what they gave me, and also faith-based. I believe those are two areas in our populations where people can do stuff right from the ground up. So my hope is that we can find many different people after viewing this actual video, that you would, you can inbox me, you can call me. All my information is right here on Facebook. You can email me. Also, my email is also here. Everything is support@seniorhealthnetworks.com. You can email me. You can call me. You can reach out to me through Messenger. Whatever you need to do to get in touch with me. What I'm asking people to do, families to do, is to take a stand. Take a stand in a national effort to prevent diabetes. Take a stand to be a leader in your family that can change the way your family is dealing with diabetes. You can be a doctor, a physician, a medical profession. Anyone out there that is working in the health industry, you can make a change by saying, hey, I'm going to do this. I'm going to join this type of a partnership. Our partnership will help individuals and work with individuals so that they can get trained. We are working with we're working with the Department of Indiana right now, but our work can be anywhere, so it doesn't matter where you're at. We can get the training to you. There is a little hiccup regarding the training, but we are working on that because we're trying to make sure that everything can basically be online. But those things are already in the works. But what we're looking for is people who we can partner with. I have faith in the people that I know. I have faith in knowing that in our communities, we normally will stand up and take a stand on something, especially as important as diabetes, because it is basically, it's rampant in our communities. It is very rampant in the communities of African American people, the Hispanic community, the Native American Indians, also Asian. These are the things that you can just go to CDC, Centers for Disease Control, and type in National Diabetes Prevention, and you're going to get all the information. So, but I hope that you would trust that you could work with me, because I really, this was brought to me, and if I was given the opportunity to do it. I am definitely a person of information. I feel information, that without information we perish. I believe that because of lack of knowledge, that's how our lives are shortened sometimes. And I'm just truly a minister on information. Information has to be given out constantly, because if you don't know what to change. So those are the things that is just close to my heart. I have a passion for it, and I've done it pretty much the majority of my life. It's about making sure to share and connect with people and letting us know that we can lead, that we can take initiative, we can stand up and be a call for an action that is necessary for our own communities, for our own families, for ourselves as people in our communities and in our families. So I'm hoping that, I will be coming on a regular basis, talking about this. And if you feel that in any kind of way, I think on this thing, I put some questions. If people want to answer those questions, it's kind of like a poll. You can answer those things. I'm trying to find and utilize every social media tool that I can. I had something through Click Tunnels where you can actually, submit your name, your email. You can get in touch with me. Either way, be it through Facebook, be it through LinkedIn, be it through Twitter, be it through email, you can get in touch with me. So even by phone also. So feel free to reach out. Feel free if you're connected to any church, if you are a minister, you're a pastor. I really, really urge those individuals who are in those positions to take a stand. This is an opportunity for you to bring important information to your congregation, to the people, because if you're going to pray for your individuals who are sick, then you need to also pray, and God said also take action. So you need to be able to look at this and say, hey, this is a way for me to bring more knowledge to my congregation, to my parish, whatever, to my temple, whatever your faith beliefs are. This program has a part connected to it, especially in the faith community. Trust me, I've done the research and I know and I've seen it, and it's amazing. It is amazing what we don't even know and what God has already prepared to say, hey, this is what I've been basically, it's already there. So the only thing we have to do is work with this. So I'm really hoping that we really get and connect with people who want to be a part of and take some action on this. And my hope is that once you do, you will get the information and you will be able to see everything that I've already heard. And I'm very transparent with everything. And I hope that we all look to join together and work together. So again, I'm in Chicago, so there's definitely things going on here. So again, I would like to say, please join me, send me an email, let me know. And I hope that I've been informative. I hope I've opened up some questions for individuals. I hope that I've enlightened individuals. And most of all, I hope I have informed you and hopefully influence you to take action. That's what we need. We need someone to take action, not just one person. We need multiple partners to take action. It doesn't matter what type of action you want to take. We need to help to do it. So again, thank you very much for joining me. I think this was about 30 minutes, a little bit over, but I really had to really lay the foundation of diabetes out. And I hope to hear from many different people and ask me whatever questions is needed, and I will make sure to get that information back to you. So again, thank you so much. And again, my name is Mary Gaines. I'm with Senior Health Information Network. Definitely like my page to get more information. You can follow me because I will be putting this stuff out pretty much once a week. And whatever you need, I'm definitely happy to supply that information to you. And I hope that everyone have a nice evening. And I hope my information will be very useful to you, your family, your community, your church, or your network of people. It's definitely something that's needed. It is a national initiative, so I hope that everyone join us. Thank you so much. Have a great evening. Take care. Bye-bye.